Hi, this is Dr. Farley, and today I want to go over the three healthcare philosophies. My daughter just asked me the other day something about, well, Dad, you're a doctor, but you're really a chiropractor. And I said, yes. So we were explaining the different philosophies and approaches to a patient's problem. In the United States, there's only three primary care doctors that you can walk into and say, hey, can you help me? There's the medical doctor, the MD, the doctor of osteopathy, the DO, and the chiropractor, the DC, doctor of chiropractic. So we're the only professionals in the United States that have those degrees that you can walk into, and you can walk in and say, hey, can you help me, and get some opinion about what they think. The important thing to understand is really the philosophy drives the doctor's decisions, his thoughts, her thoughts, and opinions. So the allopathic drug model is based on the genetic theory of disease, which means the genes are broken, your mother has it, your grandmother has it, which creates a chemical imbalance. So take this drug and that's it. We give you a lot of different disease names: thyroid, neuropathy, fatigue, diabetes, chronic pain, fibromyalgia, depression, anxiety, bipolar, weight gain, heart disease, GERD, constipation, cancer, autoimmune, Parkinson's, dementia, chronic pain, if I didn't say that. And so we give you the diagnoses, but we never look under the hood to say what's creating this imbalance. We just try to manage the symptom with usually a drug. And if it gets bad enough, sometimes a surgery. The next level down, number 2 here, is the alternative integrative model. The cause is normally genetic, and the only difference is that they're treating with alternatives to drugs. So it's still pathology focused, meaning we're treating the disease. It's based on protocols that has nothing to do with you, or you, or you, or you, and your biochemical individuality, none of that. And the diseases can be treated by alternative doctors, integrative doctors, complementary doctors, chiropractors, homeopaths, functional medicine doctors, naturopaths, acupuncturists. And the idea here, though, is usually that there's still a genetic glitch, but instead of using the dangerous drug, we'll now do something else. Well, I have a real problem with that because the thought process is exactly the same. So you don't treat the disease, you treat the person. You have to do 3 steps, which is what we do here with the Farley neurobiomedicine model. We've got to get proper testing, very in-depth testing, as deep as we possibly can to measure function and physiology. Then a proper root functional cause diagnosis. Our root functional cause diagnosis packet now, I think we're up to 47 different diagnoses, 47 problems that we see somewhat regularly in people. And then lastly is to set up the plan based off of the proper diagnosis, based off of the proper testing. So it's a science evidence-based approach to look at what's not functioning well, and then how do we improve function. Dr. James Chestnut all the time talks about physiological compatible care. It means to restore function, to restore normal physiology. If you are not restoring function and you are not restoring normal physiology, and all you're doing is popping a pill, you're moving down the wrong path very fast. You are not going to give the system a chance to get healthy, because that is not health. You may need to use that if you're in a crisis, and you may need to use that if you're a chronic patient where there's so much damage in the system. But you have to understand what it is that you're doing. You are not restoring function, and if you don't restore function, you have no opportunity to raise the person's level of health. So thank you. If you have any questions, please let us know, and hopefully you understand the 3 philosophies of healthcare in more depth. There's the allopathic drug model, the alternative integrative model, and then the Farley neurobiomedicine model. Thanks. Have a great day.